of some illnesses, we usually attribute it to old age, like rheumatism, high blood pressure, cancer. But these days, it is not like that. Young people are suffering from it. Today, we want to talk about back pain specifically. And Dr. Debbie is in the house to show us how to control these pains. My name is Edak Willie. See you shortly. Welcome back. Dr. Debbie, welcome to our program.
Thank you.
You've been here before. Please tell us about yourself.
Well, I'm Dr. D.O. Debbie. I'm a senior lecturer and clinical instructor in the Department of Physiotherapy, College of Medicine of the University of Lagos.
Okay.
I'm a pain specialist.
Ah, pain specialist.
Back pain specialist.
Back pain specialist. Okay. Please tell us about back pain. We hear a lot of people complain about back pain these days. Please, what's the cause? What is back pain?
Well, someone has said that back pain is one of the prices that we pay for being the only animal that walks on two. Most of the animals that walk on the floor, we understand, don't have back pain. I have not done any empirical study on that, but that's what we read in textbooks. But there are so many other causes of back pain, particularly the common back pain. We have two types of back pain. We have specific back pain and we have non-specific back pain. Specific means you can identify a pathology, an internal organ being the cause of the pain. Non-specific means that you cannot identify any pathology. So that is the most common one that people complain of. And for that, we have so many causes.
Okay.
Majority of it has been attributed to the way of our way of life. The way we sit, the way we carry out some activities of daily living, whether we observe the normal rule of obtaining maximum sitting posture when we sit or not. Then other causes could be arthritis, maybe like the price one pay for a long way of working. For example, if your work is in teaching job or a secretary and you sit a lot, so it could be the price you pay for the particular work. Or if it is one that you need to do some manual work, say carry, lift, bend too often, then it could also be a kind of price that one pay for that. So in short, it's due to wear and tear.
Wear and tear, okay. We hear about chronic pain and acute pain. What's the difference?
Well, the difference is in terms of the duration. When you say it is acute, in fact, there are two types. We have acute, we have subacute, then we have chronic. When it is less than 6 months, we say it is acute. The patient coming in and they complain of pain, say, for how long? Say less than 6 months, then it is acute. Between 6 and then 3 months, 6 weeks and 3 months, then it is subacute. If it is more than 3 months, then it is chronic.
Okay. Before we used to think that back pain, all those pains are due to old age. But now we hear young people complaining about it. Why is it so?
Well, like I said when I was trying to give a definition, back pain can be said to be a result of wear and tear.
Yeah, that's the
Yes, but because of our way of life now, there is a lot of changes in the way we do things. In those days, there are no much young people involved in manual work.
Okay.
But now you see young people, involved in manual work. Like for example, let's take, because I conducted a study on a secondary school student, I discovered that even if you look at primary school students, the kind of bag, their school bag, the kind of load that some of them, they put this load on their back. And then the back is not actually meant to carry load. It's meant to stabilize the upper part of the body. But when you now put the back into the kind of use that is not meant for, then the back will react, the muscles will react. And when the muscle reacts, it can come down with back pain.
So when one suffers from this back pain, what is the best way of treating it? Because most people reach out to pain reliever. Is that the best way?
Well, what the pain reliever will do is to just block your sense of perceiving the pain. But we need to know what exactly is the cause of the pain. So the first thing you do, is to see your doctor. It's an orthopedic surgeon that we kind of identify whether it's a non-specific pain or it's a specific pain. That's when he will now know who to refer to. If it's a non-specific pain, for example, he gives the initial treatment and then refer for physio. When it's a specific pain, they want to know the cause, which organ in the body is affected. They will have to do some series of tests to find out which organ is. But if it's a non-specific pain, then after the initial treatment, then it will be referred to the physiotherapist.
What do you mean by non-specific pain?
Like I said initially, non-specific pain, low back pain, means that you cannot identify any internal organ as being the cause.
Okay.
There are some problem in the internal organ that will can refer to the back, like cancer, for example. If there is a maybe Cox disease, for example, it can be referred to the back. Or if there's a pathology in any of the organ, it can be referred to the back, and someone will not think that it's the normal back pain, and you'll be wasting your time massaging, applying all sort of thing on the back, whereas the cause is a particular organ. So until that is addressed, that's a specific back pain. But if it is due to wear and tear, the normal common cause back pain, due to the way we see it, all sort of things, then that's a non-specific back pain. It can be managed by conservative measures.
Okay, I also know about people complain about the waist, like kind of they say disc or something. Maybe they bent down to pick up a heavy object, and they said the waist snapped. How can that be managed?
That's one of the pathology of the non-specific pain. Now there are two scenarios there. It could be the sleep. When a patient says that he or she has a slip disc, if you look at the spine, we have the bones setting in the back. You don't see two bone apposition. In between the bones, you have intervertebral disc. That disc is made up of two parts. It has the annulus, the ring, and they have the nucleus, which is like a gel. When someone said he or she has slip, it is not the disc itself that will slip out. It is the jelly-like substance inside. Okay. When the ring that is keeping it in place weakens and breaks, will now slip out, and now kind of compress the nerve roots of the nerve that supply the muscles of the leg, and all the muscles that the nerve that is being compressed supplies will be irritated. That's why sometimes you say the pain is going here, it's now in the foot. So it depends on the nerve that is being compressed.
Is this slip disc particular to a certain age group? Can young people suffer from it?
Like I said, the disc grow old. So usually it's not common, it's not expected unless there is a trauma. Okay. But like somebody just bending down. I remember when I was it happened to me when I was in my third year in the university. I was just about to cream myself and I bent down and I just felt a snapping sound. So that's I was about 23 then. Okay. So it's not, you can't see it in younger people unless there is a trauma, maybe something hit or accident or so. Okay. It has to be wear and tear. Okay. Maybe because of the way and then the ring now gets weakened and gives way for the nucleus pulposus to come out. Then that's when the person.
Because I see this case mostly my friends complain like from 30 years. That's when we hear slip disc or my waist. I just bent to pick something and my waist snapped and.
Well, actually, it didn't happen that particular moment. Okay. That's what we call cumulative traumatic syndrome. It piles up until you get to the peak, the one they say breaks the camel's neck, So it is that particular moment when you just say bend, when you're just about to bend down. But that's not what caused it. Okay. It must have been accumulating until you now get to the peak. It's just a little thing that will now.
Doctor, we'll be right back. Let's take a break.
A lot of times, our religion preaches that women hold a subordinate role in a relationship.
He said, what kind of a man will raise his hand against the woman? What is happening in that relationship? You must ask. Yes. I want to say this.
Let's take a break. When we come back, we'll continue from here. There's something called spring cleans. Once in a while, you give your system a rest. And how do you do that? You do it by eating only fruit.
And I was staying there for a while. Nobody was coming to turn me. I decided to do the turning myself. And I just turned, and next thing I had a snap. Until my father came, I told him, they rushed me to the theater.
Welcome back.
Well, they are born with it and they are going to live the rest of their life with it.
Welcome back. Doctor, as we were saying, can emotional distress cause back pain?
Well, that's what we call psychosocial factors, which is in line with what you just mentioned. It can kind of mask the problem and escalate it. Give you an example. There was a patient I saw one time, and the patient was improving. I just discovered that the following week that the patient came around for treatment, the pain that had come down from 7 to 5 just suddenly became 8 on a scale of 10. That's how you just say, what is your pain now if you want to scale it from 0 to 10? 0 being the no pain and 10 being the worst pain. So previously it didn't came down from 7 to 5, but following week when I just asked her, how old is your first child? And mention, where does your husband work? Say that one, don't mention it. So I knew where the problem was.
Okay.
So probably what you ask the patient to do, because of some psychological problem, patient will not be able to do them at home. Say sit right, do exercises 2 times daily. But because of some problem at home, once the patient doesn't do that, then the problem will now come back big time. So psychosocial factors kind of can compound the problem, in short. It may not cause it, but just compound the problem.
Okay.
May not allow treatment to yield good success.
Okay, but when one suffers from this kind of pains, what should be like the first step, apart from pain relief?
You see your physician.
But before I get to the hospital.
Wait, you just started in Nigeria. The ideal thing is every family is supposed to have a family physician.
Okay.
So if anything goes wrong, just call your family physician. He or she will be the one to now refer to the appropriate quarter. That's the ideal thing. Our life is functioning in line with the British life. So that's how it's being practiced everywhere. But because of the way we do things in Nigeria, well, I would suggest that, like we hear on radio jingles, if you take the medication at 2 days and it didn't work, see your doctor.
Okay. So, doctor, please show us how to sit properly and some other things that we can to help the posture.
To sit properly, we have to have a back-friendly seat.
Okay.
A back-friendly seat.
What do you mean by back-friendly seat?
A back-friendly seat is one that will take care of the low back, take care of the dimension of the thigh and trunk, then the leg and thigh.
Do you have some of those pictures?
Yes, I have some of the pictures. By the time you see a back-friendly seat, then you can now teach on proper way of sitting. Now, this is just in a pictorial diagram of what a back-friendly seat should be. Okay. You also have a armrest.
Okay.
So that's a back-friendly seat. And then to sit there, you sit right inside the seat, just like I am doing now.
Push it inside.
So that you can rest your back. Ideally, when I say back-friendly, there's supposed to be a kind of a kind of provisions at the back of the seat that will take care of the hollow of the back. If you look at the spine has 4 curvatures.
Okay.
The one by the waist is called the low lordosis. There's supposed to be a small indentation like I also have in this diagram.
Okay.
This small hollow need to be kept.
So there should be another one protruding kind of here.
It's small it should just like this one that went fly. There should be a small protrusion.
Okay, here.
To take care of the small hollow that we have here.
Okay.
So that's a back-friendly seat. Then you sit right inside, and then the knee should not be higher than the hip.
Okay.
When you sit on any seat.
Okay.
Reason, when the knee is higher, you need extra energy to level. But when the hip is slightly higher or the same, you don't need any, you just get up, on your feet.
Okay.
So the knee, whatever seat you are sitting on, the knee must not be higher than the hip joint.
Okay.
Then another thing you watch out for, once you sit for between 45 minutes to 1 hour, it is called prolonged sitting. You need to break that sitting, pace up and down, probably do some kind of extension exercise, and then you sit back.
Okay. So, thank you, doctor. Apart from this sitting position, are there other things? Because I can see like that in your book, I can see this other exercise that the person is bending back.
Yes, that's the one that I was saying that after sitting for a while.
That one, yeah.
Yes, this is just a way of breaking the sitting, prolonged sitting. You just sit for a while. Want to break the prolonged sitting, you just get up, do extension exercise 3 times, then you sit back.
But are there some exercises that one can do to help the spine to alleviate some of these back pains on our own in our houses?
They have to be recommended because the pain that are different, they yield to different exercises. Some will yield to extension exercises. Some may use to flexion exercise, depending on the what we call it derangement. If it is anterior derangement or posterior derangement, so you need to see, the person need to see a physiotherapist who will assess the back pain and then recommend the kind of exercise.
But for prevention, because I like to prevent than to treat, are there some exercises that I can do?
Keep fit, like the one we spoke of the first time I appeared on your show.
Some of our viewers may not have watched it.
Well, what I would just say there is just to gradually get yourself used to a routine exercise, probably in the Keep Fit Center.
Okay.
I said gradually, mark my word, gradually. Yeah. You should not be exposed to what others have been exposed to. You have to gradually get yourself accustomed to the exercises in the Keep Fit.
But in some centers, they may not really know the exercises for the back. Because today we are talking specifically about the back pain. Are there exercises meant for the back?
Yes, there are.
So as to prevent?
Yes, there are exercises meant for the back.
Can you please describe?
Where we have extension, we have a rotation, we have strong rotation, we have back hiking. When you lie on the floor, then you hike your back, then you lower it, then you have alternate leg and arm.
Please, doctor, hold it out. We'll be right back. What's the death rate like when it comes to malaria?
Annually, in a country like ours, about 300,000 children below the age of 5.
Some women are not psychologically ready to engage in any form of, intercourse. So they need some time for their body to heal, which some men don't have. Nigerian men don't have patience.
Sorry.
That's their flavor.
Let's take a break.
That's their flavor.
Shall we come back?
You see, like, what's your flavor?
Welcome back. Let's have David to our set for our demonstration. Doctor, please show us how to do it.
Okay, please can you just lie face down? Okay, like I said, alternate hand and leg. Your right hand forward. So you raise your right hand and your left leg. Stretch them. No, just raise them. Yes, stretch the other. Yes, up a bit and count 5. 1, 2, 3, 4, 5. Down. Change the other leg and hand. And raise up. And let's count 5. 1, 2, 3, 4, 5. Then the back hiking. Can now rest on your on the floor. Knee down. Yes. No, your hand. Just yes. So you hike your back and then you raise it down. To the count of 5. 1, 2, 3, 4, 5. When you're now pressing it down now, you do as you want to look at the ceiling. You just gradually look up. Yes, to the count of 5 again. 1, 2, 3, 4, 5. This is set. Okay. Another set will now be the one on line face up. So you can now lie face up Now this is flexion. The other one I did extension. So you can do single knee to chest. Just one knee, raise one leg up, and then try and pull it to your chest. Your head down. Just relax. Then count 5. 1, 2, 3, 4, 5. Relax. Then the other leg, pull as far as possible to your chest. 1, 2, 3, 4, 5. Then double knee to chest. The 2 knees now. Okay, then 1, 2, 3, 4, 5.
Okay, thank you, David. Thank you very much. Medicine in your kitchen. Yeah, what you eat. Keep saying, this is bitter leaf. It is #1 first aid to any stomach problems.
Every day, different solutions of extramarital affairs. A man just killed the wife because she was caught cheating. He said because the wife asked for the money, he couldn't provide the money. The next thing she did was to sleep with a neighbor. I ended up slaughtering her. That is a pure case of extramarital affairs. And that takes us to where? Societal pressure.
Doctor, please, where can we get this book?
Well, you can get it on WW Nigerian Bar School.
Okay.
That's which I developed in 2004. Is a place where one can actually go and get yourself used to and demystify yourself about back pain. So there are so many things. Some people say it's when you take pain that the back pain will go. So when you get to the website, it will tell you, the right way, like we have just stated on this program, on how to manage back pain.
You can get this book on the website, or you can call us. Get in touch with us for this book. Stay with us. Medicine from your kitchen. Sea salt. You get it from your market. It is a local salt. It has not been refined yet. What you do, get 2 spoons of this, add it to your bath water, preferably warm water. Soak yourself in it. You'll be relaxed and you'll sleep like a baby. And if you have troublesome mother-in-law, just do this for her. She'll love you for it. That's my tip for you today. Sea salt. Thank you for watching and see you next week.